You hadn't gone to the dentist in 20 years.
Right.
And you came in at that point at the request of how did you get to our office first of all?
Well, actually, it was a referral from both of my parents that actually were coming to your office, and recommended that I come in, especially in view of some of the pain in the areas that I was having for an evaluation.
Why did you wait 20 years?
That's a good question. The only thing I'll recommend to anyone is not to wait 20 years and have to go through what I went through. But it's one of those things, I think, where just like a doctor's visit, people put it aside. It becomes not so important. You don't think so in the grand scheme of things, but ultimately it's helped me go through a realization that you only have your health once in this lifetime, and you better take the best use of it that you can.
Before we did the treatment, I told you about LANAP. Did you research it at all?
No, I didn't. I had actually, well, I say I didn't. I actually did, get some feedback from some friends and people that had actually gone through it. And again, you're getting third-hand information, so I didn't really consult another professional. But but in that same breath, I still felt I was a little bit prepared for what was going to happen. But the transformation is something that I couldn't have prepared for. Even after the procedure, I was still very concerned, but I've been very pleased with the results, and hopefully things will continue going in the positive direction that I've seen.
So you had treatment, and we got rid of the pain, the bad breath. Tell me about that. Who told you had bad breath?
Well, actually, a couple of colleagues and friends, would make general comments, and you'd always write it off to maybe something you had eaten or had something to drink. But then when I came in for the evaluation, I know it was very difficult for you to examine me. But since the surgery, basically everything has just been night and day. I think even the first time I even came back to see you for my first evaluation afterwards, you even commented on it. I mean, it was amazing, the transformation that had taken place from the recovery with my gums.
Were there any stitches or any cutting to do this procedure?
No, there were none whatsoever.
Did you have a lot of pain afterwards?
I did for maybe the first 2 or 3 days, but part of that was probably self-inflicted for the 20 years that I took to get in here. But no, I would say within several days I was back to chewing and eating like a normal person.
How did that affect your professional life as far as how you dealt with clients and things like that?
It's been interesting. I think there's a little bit more confidence. I think when I go in to see somebody, obviously I'm not self-aware of my breath, or anything like that. So when I go in to see somebody, I feel like they're getting more of me than they are, getting someone that was maybe being held back by something.
And what has your family said? Your wife and children?
They obviously they love it. Dad's walking around with a little bigger smile these days, and obviously not being in pain. But I think you have a tendency when you're in pain to sort of try and compartmentalize it and not really focus in on it. But it's you can just see the difference, in the way not only I interact with them, but with my friends, family, and colleagues as well.
How about your teeth? Are they more stable now?
Much more stable, and no more pain. Everything is going according to plan as long as I follow the doctor's orders. So.
And what is the plan?
The plan is take good care of your teeth and being here every couple of months. Just to be evaluated until we get to the point to where everyone's comfortable that everything is stabilized, and then obviously regular checkups going forward.
So how would you, if somebody had some gum problems, what would you tell them?
I would tell them get in and take a serious consideration to this procedure, because I was in and out within the course of a day, or actually a morning, to say the least, and then within 2 or 3 days I was back on my feet and rocking and rolling again. So
good. Well, thank you so much for sharing that information.